Good afternoon, everyone. Thank you. So welcome to our presentation. The title of this session is One Community's Journey from Youth Substance Abuse Tolerance to Effective Prevention and Early Intervention. So if that's the session you are heading for, you're in the right place. I wanted to also make a couple of announcements before we get started. The first announcement is this is being live streamed, and so we'll be encouraging people to use microphones and hold questions to the end, and we'll be sure to leave plenty of time for questions, and we'll also be available at the end of the presentation if we run out of time there for questions. And then I wanted to say a word about the handouts that are on the chairs. Everybody should get a handout with the blue boxes. And then there's a one-page handout that just has a lot of numbers on it. And the intention is that we'll be doing a short activity. And so there's one paper for two people, and they're all a little different. So if you need either one of those, just be sure and let us know as we get towards the activity. Okay? All right. So we, of course, want to start with disclosures. None of the three of us have any conflictual relationships to disclose. Our objectives today are to identify the 12 sectors of a community that are critical to involve in a community coalition effort. We'll also be describing at least two elements of an effective substance abuse prevention program. And finally, we'll be talking about a single organization, which is Seattle Children's, our strategy to partner with schools and the community for youth substance abuse prevention, early intervention, and treatment. Our comprehensive program includes community prevention and school prevention, as well as early intervention in the school, as well as a level 1 outpatient chemical dependency treatment program. Our specialty is caring for teens and young adults who have co-occurring medical or mental health conditions in addition to substance use. And when I mean what I'm referring to when I say specialty is that's our treatment program practice. In the community and the schools, we have a slightly different focus. And then we use the most current scientific evidence to guide our practice. We use this collaborative framework, starting with a very broad base of community prevention. Then our next level up is school prevention and early and brief intervention services at a middle school in Northeast Seattle. And finally, we have a treatment program for the entire Seattle metro community for teens and young adults. We've worked hard on diversification. Two partners that are not on this slide, but I want to acknowledge, are Seattle Public Schools and the Washington State Division of Behavioral Health and Recovery. We do receive federal funding from SAMHSA, a Drug-Free Communities Award, using an environmental strategy which our community coalition utilizes. We were funded for 5 years as of 2010. We also receive local funding from King County, and it's a mental illness and drug dependency grant. And this grant is specific to a selective strategy that we use at Eckstein Middle School, and we target high-risk students and their families. And that grant was also received in 2010, and it's a 5-year grant. And finally, we received support from Seattle Children's, a private nonprofit hospital, and we provide a level 1 outpatient treatment program within the Division of Adolescent Medicine, and it's staffed by an adolescent medicine specialist, a psychiatrist, as well as our chemical dependency professional who is also a licensed mental health counselor. So here you can see kind of the Venn diagram of our treatment model, and each of our segments intersect in some way with each other. One thing we wanted to do was present a case study that you will hear about this young man interwoven through each of our presentations. Buddy's a 12-year-old sixth grader at Eckstein Middle School. He has an IEP in place because of a history of disruptive behavior in class as well as problems with his grades. He's extremely bright. He loves to read, but he does struggle with writing and math, so he has to attend an extra study hall and after school homework center. He does tend to hang out with older students, and we often see him at lunch and around the playground or the fields with eighth graders. He currently lives with his mom, his 14-year-old sister, and his 7-year-old brother, and he is not in contact with his father at this point. So keep that in mind, and you will be hearing more about Buddy. And to talk, we're going to segue now into community prevention. I'd like to introduce Inga Manskopf, our Community Coalition Coordinator.
So excuse me while I move the microphone here if it makes a little bit of noise. So good afternoon, everyone. My name is Inga Manskopf, and I am the community coordinator for a coalition in Northeast Seattle, Washington, called Prevention Works in Seattle. It is a community coalition with the mission of preventing youth substance abuse among Northeast Seattle teens. We are based out of Children's Hospital. Children's Hospital acts as our fiscal agent and provides other support to me and the coalition. And I'll talk a little bit more about the coalition through my presentation, but I wanted to start with a little Calvin and Hobbes comic strip to just start thinking about prevention, about why we do prevention. And from my point of view, if you read through that, they're talking about a cement truck coming down the road. And from my point of view, that cement truck is substance abuse, youth substance abuse, and my goal is to make sure that we look down the road, we plan for making sure that we don't have substance abuse problems. We don't get hit by that cement truck down the line. My part of the presentation today will cover these 4 things. First, I'll be talking about what a community coalition is and why it's important to have 12 different sectors involved in the coalition. Then we will talk about focusing, so you get all these people from your coalition, all these people from your community around a table to talk about substance abuse, but you want to be focused in what you do. And then we'll do a brief activity, and then I'll talk briefly about next steps. And let's see. I thought I'd start off with what is substance abuse prevention, because many people think of substance abuse prevention as a curriculum in the schools, and that is correct. That's what substance abuse prevention is. But those are just individual strategies. From a coalition standpoint, from a community standpoint, we also look at environmental strategies. So individual strategies would be something like, as I said, a middle school curriculum, that's an evidence-based curriculum, or a parenting program, so that you're reaching individuals and teaching them how to either refuse drugs or help their kids refuse drugs. Where our coalition looks a lot at those environmental strategies, the wider picture of where kids live and what is contributing to substance abuse in the wider community. For instance, alcohol taxes. The higher the alcohol taxes are, the less likely kids are to drink alcohol. That's a proven strategy. Another thing, I have a picture up there of Seattle Hemp Fest. In Seattle, in the summertime, there's a big hemp fest, and people smoke marijuana all weekend long out in the open downtown Seattle. That goes towards community norms around marijuana use. Not that our coalition is necessarily going to be able to do anything about hemp fest per se, but that goes to the more general community norms around substance abuse. Things like advertising and checking for ID, those are also what we consider environmental strategies and things we look at as in a coalition. And the idea is that we're looking at having population level change with environmental strategies. So a community coalition is a group of people who get together with a common goal of preventing, in this case, preventing youth substance abuse. And how many of you are familiar with anti-drug coalitions? Can you just, a quick raise of hand, how many of you are familiar with anti-drug coalitions or have them in your communities that you know of? Okay, a few of you. Okay, great. I highly recommend, if you have an anti-drug coalition community in your community, that you get in touch with them. They can be very powerful in bringing people together and making differences in their communities. My coalition, as I said, we cover Northeast Seattle, which is 3 zip codes and is rather an affluent part of town, a part of the city, though we do have a poverty rate that is equal to the city average for poverty. Most of our prevention focuses on Eckstein Middle School, which is the one middle school in our community, but we also work with 2 high schools, Nathan Hale High School and Roosevelt High School in Northeast Seattle. And our coalition was formed in 2006 when we received a grant from the State Department Division of DBHR, Division of Behavioral Health and Recovery. So in 2006, when we received our first grant from the state, the first thing we did was get 12 different sectors around the table to talk about substance abuse and why it's a problem in Northeast Seattle. These 12 sectors, I should say, are drug-free communities sectors. The Drug-Free Communities Program is a federal program that funds coalitions, and they define these 12 sectors. There are other models that you can use, there are some links in your handout that talk about these things too. The Communities That Care also recognizes a certain amount of people who need to be around a table. So number one is our youth. And of course, as most of you probably recognize, that if there are going to be programs for youth, that it's good to have youth involvement and the youth voice involved. And so mostly we do that through our prevention clubs. We have a prevention club that we provide support for at the middle school and at one of the high schools. And not only do they do outreach to their fellow students, but they also provide a voice for our coalition. Parents, they have been key for our coalition. Not only have they have different parents served as co-chairs for our coalition, but I have one coalition co-chair who loves to talk to the media, and whenever we have a media story about underage drinking or substance abuse, most of the time the media wants to talk to a parent, and I have a parent who loves being on TV, and it's wonderful having her on board. We also have parents who do outreach to other parents. They set up a Facebook page, a website by parents for parents in our community. I can't emphasize enough reaching out to parents. Businesses, well, we don't have a lot of direct participation by businesses in our coalition. They're great to go to for pizza if you want to have kids, their youth groups, give them pizza or something, or provide other sort of financial support that they've been wonderful to go to for that. But we're also increasing our work with businesses as the laws change in Washington State around liquor control, liquor sales, and we're working with businesses to make sure that they don't sell to minors. Or what we're finding right now is that minors are stealing liquor, so making sure that they have the security in place so that kids can't steal liquor. So next is media. I briefly talked about that already, but we do have one of our coalition members works for King 5 TV, which is a local TV station in Seattle, and she has been great in terms of raising awareness about underage drinking and youth substance abuse through the media. She as being someone who works inside of media, she can pitch a story any day of the week. I send her some information about something I find interesting. The next thing you know, we have the media calling us saying, can you provide us more information about this underage drinking accident that happened, or what's going on with different things having to do with substance abuse. And actually later on I'll show you a little clip. The school, well, of course, schools, not only school building-based staff, but district level staff. For instance, especially if some things have to do with school policy, what we found, I'll talk about this later too, but we found that having people at the district level who can have an influence on the policies in the schools has been very important. And then law enforcement. You see the police officer in our coalition up there in the picture. He's been on board since the beginning because he is the one who, if there are kids passed out in a public park from drinking too much, he's the one who comes across them. He's the one who's breaking up the large underage drinking parties in our parks. And as he says, as he gets older, he has a hard time chasing after all these kids. So he really wants to deal with prevention so that he doesn't have to try to run after them. And but he's been also great for community awareness. Before our coalition started, nobody really heard from the police what they see in our parks. And he came to one of our first big meetings, our community meetings, and talked about the underage drinking problems in our parks and the problems that he runs into. And that was a big awakening for our community. And they also play a key role in working with retailers who might be selling alcohol to minors. Religious and fraternal organizations and civic and volunteer organizations, they are great for community outreach. They're out in the community in all different areas. It's great to have them on board just to spread the word about the coalition. Healthcare, Children's Hospital, of course, has been a key partner with us, but also we work with school-based health clinics from the 2 high schools in our community, and they provide with information, medical information, health information. They are great to get information to students, to parents, to within their schools. They I keep saying they're key, but and each one of these sectors is really key to the success of our coalition. Government, because of their links to services and to funding sources and other substance abuse prevention programs. Some communities don't have other substance abuse prevention programs. It's hard to sometimes find someone who is just doing substance abuse, so sometimes you have to dig a little bit deeper, especially with funding cuts the way they've been going lately. So in 2006 is when our coalition was formed, and as you see, we had a Nathan Hale High School 10th grade underage drinking as its current 30-day alcohol use rates. We're at 39%. At Roosevelt, they're at 38%, and they're above the state average. And by the time we looked at the healthy use survey data, healthy use survey is what is given in Washington State. It's similar to the YRBS, but it's a Washington State health survey that's given to all Washington State students in 6th, 8th, 10th, and 12th grade. And we were looking at 10th graders because they were the first kids to get our interventions. So we were very interested to see what was going to happen with those kids. Anyway, as you see, by the time 2010 rolled around, we had cut in half the Nathan Hale High School underage drinking rate and significantly reduced the Roosevelt High School underage drinking rate for 10th graders. As you see, Washington State went down too, but ours went down more significantly. And now we're going to play a little clip, it's a minute-and-a-half clip from King 5 TV, which is our local TV station. We had a celebration last October to celebrate this reduction in underage drinking rates, and we got some media coverage, and I just wanted to share that with you real quick.
In just 4 years, some schools in Northeast Seattle make a dent in underage drinking.
Schools that were once above the state average are now well below it. King 5's Joe Fryer shows us how they did it.
The food spread alone makes a pretty strong statement.
More snap pea and carrot action.
These people care about what you put in your body.
You could potentially be saving people's lives here.
For these 4 students here at Nathan Hale High, it doesn't stop with food.
Coming in as a freshman, I saw a lot of people using drugs and alcohol around campus.
It's why they got involved in RAD, a group that bluntly talks with peers about underage drinking and drug use.
I don't want to see my friends turn into the person that people see on the street laying on the ground throwing up. I don't feel good about that.
Tonight they're celebrating a big achievement. Surveys show the number of sophomores at Nathan Hale who admit to drinking dropped to 20%. That's a 19% drop in just 4 years.
I think it's really exciting because I get to be a part of RAD, and I can say that I was a part of making a significant change in our community.
Schools across Northeast Seattle are seeing a big dip, and tonight they talked about what's working. Just listen to what Principal Jill Hudson experienced 2 years ago.
Kids would tell them Nobody does anything. I come to class on. I come to class on. Nobody does anything.
So they taught the staff what to look for and started cracking down.
It's because we care.
Parents signed pledges to keep underage drinking out of their homes. The football team even wore red ribbons to raise awareness.
And I just want to be a setting example for a positive change that anyone can make in their lives.
Bit by bit, the healthy choices are becoming the popular ones. In Seattle, Joe Fryer, King 5 News.
Roosevelt High saw a 13% drop in underage drinking in the past 4 years. Statewide, numbers have also dropped, but not nearly as much.
I'm so glad she put that in at the end. Now I lost my train of thought. But so one thing they allude to in that video clip is that it wasn't just that we started implementing an underage drinking prevention curriculum at Eckstein Middle School or parenting programs at middle school, at the middle school, but we also asked parents to sign a pledge. We also worked with law enforcement. We did multiple things in the community to work on reducing underage drinking in our community. And so that's really what the beauty of a coalition is that you have many people working on the same issue, and we think that it contributed to our reduction in underage drinking rates in Northeast Seattle. So part of your handout, what I'm going to go into now is just how we started. So yes, we got the 12 sectors and more together in our community, but then what did we do? How did we get this all started? And the first thing we did was look at our local data. As I said, we have the Healthy Youth Survey, which is similar to the YRBS, and we looked at the different substances that were being used by kids in our community and what was the highest, and at that point it was underage drinking. It was higher than the state average. So we looked at our Healthy Youth Survey. We looked at school climate surveys. I don't know how many schools have school climate surveys, but in Seattle Public Schools, every year they survey parents, kids, and staff to see if the kids feel safe at school, if there's bullying, if they like school, that sort of thing, and that can inform substance abuse prevention also. We looked at U.S. Census data. Since our community is relatively affluent, that was a good thing to know because that did impact how our prevention strategies were implemented. And what we end up having to do is find more data that wasn't available. So our coalition actually collected our own data eventually. So as I said, we had existing data sources that we used during year one, and then we started thinking about, well, what else? We need to know more. This doesn't tell us everything we want to know. So, and this is another reason why you want to have lots of different people from different sectors on your coalition. For instance, we surveyed the North Precinct Police. Do you enforce underage drinking laws? If not, why not? What's getting in the way? And they told us pretty much they don't enforce underage drinking laws. But without a police officer on our coalition, there was no way that we would have gotten that survey done. Same thing with the juvenile court services. There's no way we were going to get our survey done by anyone there if someone from there wasn't on our coalition. We did a parent survey, we did a student survey, but we also did student focus groups in the high schools and the middle school. And in the very beginning, we did a lot of brainstorming. We said, so underage drinking is a problem in our community. Why do we think it's a problem? We don't have all the data that's going to tell us, but we do have a bunch of people who work in our community, who live in our community. Why do they think it's a problem? And that was a starting point. And another starting point was one-on-one interviews with community stakeholders. So, your principals, your PTA president, that sort of, the police chief if you live in a small community. Think about who knows about underage drinking or youth substance abuse and do one-on-one interviews with them. So this brings us to the handout. What I have, what we started with was a logic model, and that then informed our long-term strategic prevention plan. And to start the logic model, you need to know, again, why is in our case was underage drinking a problem in our community? So you have the problem, then you ask why, and then why specifically in our community is this a problem? And as you see on the bigger squares, I have what we found in Northeast Seattle. So underage drinking in Northeast Seattle is higher than the state average. And that we got from a Communities That Care survey in 2004 and then the Healthy Youth survey in 2006 and 2008. And then what is great about the Healthy Youth survey is then it also breaks things down by risk and protective factors. So what factors are putting kids at risk for underage drinking, and what is happening in our community that protects them. And so what we found as a major risk factor in our community was what the prevention people call poor family management, and that's a prevention term. Don't get too hung up on it, but it's just a general term meaning that something is going on in families that is contributing to underage drinking. But then you say, but what is that? You know, especially in our community, what is that? Is it that parents aren't home? Is it that, you know, what is it? So the first year we had to guess. That's pretty much what we did. But then we did a parent survey in 2007 and then later on in 2009 that showed that there are no consequences, that parents talk to their kids about not drinking, they talk to their, there's open communication about that, but there are no consequences. And they wouldn't, if there are no consequences, there's no follow through. And kids would tell you that too, that, you know, that yes, parents talk to me, but I never get caught. So that could help us figure out exactly what we needed to do in our community for prevention. And one of the things that we did was implement a parenting program at Eckstein Middle School, and which Kelly will talk about later. And these are two more examples of what we found in our community. So again, the left-hand side is always going to be that underage drinking was a problem in our community. But the top middle one, youth easily access alcohol. Again, that was a risk factor that came up on the Healthy Youth survey. And then when we started talking to the Liquor Control Board and to the police and to others in our community, we found out that there were several retailers that were, especially mini-marts, that were selling alcohol to minors. In fact, we found that there was one 5 blocks away from the school that would sell to middle school students. So it wasn't just minors. And so then we knew, well, we need to work with police, we need to work with the Liquor Control Board to get that license removed, and that's exactly what we did. And then the third one there has to do with schools, and this was, we didn't even end up putting this in our logic model because it got taken care of so quickly, but it used to be that Seattle schools didn't have any consequences for students if they were caught for the first time with drugs or alcohol. It was a slap on the wrist, don't do it again, and that was it. So we, after interviews with school staff and other people in the community who deal with juveniles, they decided that maybe we should change the school policy about that. It was, and that's where it comes in when I talk about having not only someone in the school on your coalition or involved with your prevention activities, but having someone on the district level, because we did have someone on the district level on our coalition at that time, and she said, oh, this isn't right. And she just went and said, within the next 6 months, we're going to change the school policy, and she got it changed. It was changed to, so, and correct me if I'm wrong, Kerby, she works actually in the schools now. It is if they're caught for the first time, they get a short-term suspension that can be reduced if they receive an assessment from a drug and alcohol counselor. And they also need to follow up with whatever the drug and alcohol counselor says. Is that a fair representation?
It's long-term suspension, and it's shortened if they get the assessment.
Okay. So it's pretty much suspension that can be reduced if they get an assessment. And one way the school district was looking at this is they really wanted it so that parents would become involved. So that as a carrot for the parents to get their kid back in school, they make sure that their kid got an assessment in the community. That was one of the things that prompted to change it to what it is now. So, and then this is kind of what part of our logic model looks like. So we have the light blue area is what we've been talking about, the problem, why, and why in our community. And then we can look at strategies, activities, outcomes, short-term and long-term outcomes. And for instance, the middle one with the poor family management, then you have lack of consequences at home. We decided to implement strengthening families at Eckstein Middle School, which Kelly will talk about in a little bit. We offer it twice a year. Those are the activities around that specific strategy. We have other strategies too about poor family management, but that's just the one I have up here. And then you can see outcomes. Short term, we want there to be increased communication between parents and their kids about consequences. Then a medium, intermediate outcome being youth are aware of the consequences. And then long term, we want the Healthy Youth Survey to show that kids perceive that parents are going to implement consequences if they're caught with alcohol. And then this sheet, there was another sheet that that was on your chair, and it's a bunch of data. Okay. So, and this is similar to what our, if you don't have someone who can help you with data, we have hired someone to help with data on our coalition. We subcontract with an evaluation consultant, and he put together this trend data for us. So if you look and this is at the top of your data sheets, that these are the top line is a 30-day use of alcohol, and you can then see in 2006, 2008, and 2010 how we progressed in our community. And then we have comparison to Seattle and then to the state. And the same with marijuana, painkillers, binge drinking, and I included other ones on yours too. These are the ones that we look at because these are the ones in our community that are a big problem, but some communities have a heroin problem, so you'd want to look at heroin use rates. And we also have someone, have you ever driven in a car with someone who's been under the influence? And then if you look at the bottom part of your data sheet, it is talking about environmental issues that contribute to underage drinking or substance abuse in the community, and other community risk factors. And that's where you'll see the poor family management. And you can see trends over time. So what I'm hoping to do now is just a really quick activity for all of you. So if you could talk to the person next to you. I saw someone roll her eyes. And if you don't want to, you don't have to. This isn't a forced activity. But just to give you a sense of the process it takes to start defining the problem in your community, if you look at the data sheets, see if there's a trend and everyone has, and they're different high schools. I made names up for different high schools. So you want to see if there's been a trend one way or another. Has there been an increase in heroin use? Or has it just always been high? And then look at the risk and protective factors and try to figure out, well, why do you think this community is struggling with whatever substance issue that they have? And that would go, so then the first part would be the problem would go in the first square, and then the risk and protective factor in the second square. Does anyone have any questions about that? We're going through this real quick. Yeah, you want to just go around? Just need to look at the chairs. There's some over there. So 2 more minutes and then we're going to wrap it up, or wrap up the activity. All right, so if you can wrap up your conversations. Oh, you have a question? So what I'm hoping to do is if there would be 2 groups that would be willing to share what you think after looking at the data. What do you, if is there anyone who'd be willing to step up to the microphone and tell us what your discussion was like, what you identified as a problem in your community and why, and if possible, why here? Does anyone want to share what they think? Or should I pick somebody? All right, share.
Sorry. So we were looking at data. I don't know if anybody else has the Brown High School data. Does everybody have unique data? Or is it? Brown. We have Brown High School 10th grade data. And first we looked at where was there use rates or a variable that was either higher than the city average or higher than the state average. The one that we identified was 30-day use of marijuana with a state average of 20%, city average of 21.7%, and a fairly steady rate of 24.7% use in the high school over the past 5 years. And then we took a look at indicators or environmental variables, and it was becoming, while still not as high of an indicator as in the state, the ease of getting marijuana was increasing within the high school. The perception of ease of getting marijuana was increasing. And along with that, the thought that they would get caught was decreasing. And we saw then, and then we looked at community risk factors and really took a look at the ones that stood out were the peer and individual risk factors. Favorable attitudes towards drug use were really increasing, and friends' use of drugs was slowly increasing. Yeah, there was also an academic and a strong indicator in the academic ratings. Academic failure, the percent of kids with academic failure was increasing from 45% up to 48.7% over the 5-year period. But I knew that in some other studies it had been shown that academic failure actually precedes marijuana use. And so so we sort of left that out as a variable that could be influencing it.
Yeah, I think that's a great example of, so you might have lots of whys in your community, but then you need to figure out, well, what why can we address? Or what why is it, if there's research that shows that school failure precedes marijuana use, well, I mean, it's a little bit different of a different strategy that you want to take. So when you look at the whys, you might not be able to do everything to reduce the whys, all the whys. You have to figure out in your community what you can do and what makes most sense. Does anyone else want to share? And I should say, yeah, go ahead. You can come up to the microphone, or do you have a question? No, you? Yeah. I was just also wondering, was everyone else who had Brown High School come up with something similar to that? Okay.
My name's Lisa Burke, and I'm a nurse practitioner in school-based health in Lawrence, Massachusetts, which is about half an hour north of Boston. It's a big high school of 3,400 students and lots of issues. Our main problem is that... Oh, really? Yeah. The world is small. School-based health is small. Our problem is that the state average for teen live births is going down, and ours is staying the same. So now we're rated number 2 in teen pregnancy, and we're just starting a coalition, and I'm loving this logic model. We're quite overwhelmed with many factors. People are not in high places, all those wonderful supports you mentioned. They're not recognizing this as a problem. Oh, that's how, it's a predominantly Latino community. Oh, Latino families like to have their babies when they're 15 years old, and that's what their moms did. And, there are so many kids going on to college and great success stories. But that's our problem right now, are the barriers. So we're assembling a coalition of key stakeholders in our city. We have a new state receiver running our schools. The old superintendent is in jail, really. It's like the Wild West. I'm not making it up. And so we have a new start, and that's going to be helpful in our surge. But could you take a couple of minutes, or maybe it's part of your presentation, to talk about some of the barriers? Certainly, it's in your 10 minutes you were like, oh, and we got this person and that person, but I know there were many, many struggles. So are there any that really stand out, and do you have any key strategies, or is that part of your...
No, I wasn't going to talk about I can talk a little bit more during the Q&A at the end, but we definitely did have some barriers, and we still continue to have barriers. For instance, with the law enforcement, we do have a police officer on our coalition who is great, but he's a patrol officer, and he doesn't have much influence higher up. So he can tell us, and all the other patrol officers can tell us, that underage drinking laws aren't enforced in Seattle. But when we try to bring it up higher to get policy changed so that underage drinking laws are, it doesn't go any higher than that. So that's just one example of barriers, and getting people around the table, especially in the beginning, is difficult. When I talk about businesses, it's been hard to get businesses around the table, and part of that is because they don't see what's in it for them. Since the liquor laws have changed in Washington State within the past couple months, they might start seeing what's in it for them, but it's been hard to get that too. But we can talk a little bit more about that afterwards. I mean, coalition work, let me tell you, it's the hardest work I've ever done. Yes. I've done HIV prevention work, I've done teen pregnancy prevention work. I think that this model of coalition is very difficult, but on the other hand, it's been the most rewarding work I've ever done. I love my job. And yes. I'm glad you brought up the teen pregnancy thing, because these type of things aren't only for substance abuse prevention. It can be, if substance abuse isn't a problem in your community, heck, use it for pregnancy prevention, use it for suicide prevention, use it for other things. But these are all issues that have community implications, and so having a community work on it is really a powerful thing.
And I just want to say that I think what we're all inspired by in this room is the children. They want better lives than what their parents have had, many of them do. So it keeps me going every day. But thank you.
Thanks for sharing that. So before I introduce Kelly Kerby, I'm just wrapping up my section and thank you both for being the ones to come up and talk. The next steps, just in general, is, as I said, determine if you can do something about the but why. If poverty is the why in your community, your coalition may not be able to do much about poverty. However, you can be parts of other coalitions that are dealing with poverty, sure, and bring them on board to your coalition. But determine that the why is something you can do something about and that you want to do something about. You want to have a little bit of passion behind it. Kelly's going to talk about the strategies that we implemented in our community for the why here. And the other thing I would say is that you need to collect the missing data. If you know that, the whole family management thing. Poor family management doesn't mean anything. You need to collect your own missing data. And I'll be happy to take questions after Kelly's done. So thank you very much. And now Kelly Kerby is a chemical dependency professional and a licensed mental health counselor who works at Eckstein Middle School, which is the middle school in our community. And she will talk about the prevention strategies that are being done at the school.
All right, thank you, Inga. That's a tough act to follow, actually. So yeah, you're speaking about the kids, so that's my job. I get to work with the kiddos. I get to do the fun stuff, I think, anyway. And so these are some of the kids that are in my prevention club, and I'll talk about a little bit about that coming up here, but that's Eckstein right there. And Eckstein is a middle school, 6th, 7th, and 8th grade. It is the largest middle school in Washington State, but after 3,400 kids in a high school, it doesn't seem that bad. But it's the biggest one in the state, and like Inga said, I'm a chemical dependency professional. I am employed by Seattle Children's Hospital and not the school. Part of that is because Seattle Children's is certified to do chemical dependency work, and there are, so they can put a chemical dependency counselor in the school that's actually certified as opposed to someone that maybe just has a little bit of training in that. So I work closely with school administration, counselors, teachers, and my role there is really prevention, screening, and brief intervention. So I'm not there to do lunchroom duty or anything like that. And so it's part of a grant that Children's received. It's a mental illness and drug dependence grant to have a person full-time in a middle school. And like I said, I'm there to do prevention. We have kind of two methods we do. This one is universal prevention, and that is programs designed for all students. So just overall school prevention. And some of those programs are the life skills training program that I'll talk more about, assisting with assemblies, my prevention clubs, and then we do selective prevention. And those are programs that are targeted at students that have been identified as high risk, or they've maybe actually been caught at school for something. And so that's where the screening, brief intervention, referral services come in. I have an Alateen group, and I have a strengthening families program that Inga mentioned, and I'm gonna elaborate on those a little bit. But I hate to end the presentation with how to be successful, so I'll begin. And just some of our kind of keys to success with this program is really the support of the administration. That's just really the key piece. And we have a principal and then 3 assistant principals, and I have kind of a go-to principal. I have someone that's kind of not technically my supervisor, but that's kind of the person I can go to. I meet with her on a regular basis, and she's able to come to me with things, and I can go to her with things. And so that's been really helpful to kind of have someone identified. And I work with all of the principals, but it's just kind of having one person that's identified is nice. I consider myself part of the counseling team. They've been very welcoming. I have kind of had to set boundaries with that about what I'm there for. Yes, I'm a licensed mental health counselor, but I'm not here to do therapy. The teachers and really anyone in the school that'll support me, I'm gonna try to get on their side. So, the school nurse and the after-school program people and even instructional assistants, they point out kids to me that maybe are struggling. And one of the keys has just been really being flexible and being willing to kind of support however I can support, as long as it's with, like I said, within the boundaries of my position. And then just finding a way to relate it to prevention. So like I said, I'm not there to do like prevention, to do like lunchroom duty, but I will do a prevention club during lunch. So I'll do something like that as long as it's kind of related. And then partnering with outside agencies, especially the coalition. So we're back to Buddy, as promised, our case study. And so Buddy is caught drinking at school. His mom is called, and he's given a long-term suspension, but his mom is told that the suspension can be reduced if Buddy is screened by the drug and alcohol counselor, me, and follows through with any recommendations. So the screening, brief intervention, and referral process kind of goes into place. So the assistant principals would direct Buddy's mom towards me, and I can provide a drug and alcohol screen to identified students with permission. And we use the GAIN-Q screening tool, if you know the GAIN instruments. And this is kind of a longer screening tool. It takes about 45 minutes. I think it's a good length for a middle schooler. It can give you, you can get a good 30, 45 minutes, get a good amount of information, and then I can determine, do they need a full drug and alcohol assessment? Can I make some recommendations from here? And then I do brief intervention, and people are kind of like, what's that about? Can you see someone continually? And that's really just me kind of motivating kids or motivating families to either maybe they just need to make a few changes, maybe they need to get involved in some resources or treatment. So just kind of a brief time. I'm not there to do treatment. I can refer to treatment. So that's kind of my third thing. If treatment's needed, I'm going to refer them to a local agency, probably Seattle Children's Hospital, and then, or students can kind of self-refer to me and I'll, find some resources for them. So Buddy is given permission to do a substance abuse screening. Mom is very upset about his drinking and shared she's a recovering alcoholic. Buddy and his siblings have only been reunited with her for the last 2 years. Buddy and his older sister were removed from her custody and sent to live with their grandmother when Buddy was 5 years old. And Mom is concerned about Buddy's attitude at home, his behavioral problems, and his choice of friends. Like we said, he hangs out with a lot of 8th graders all the time. So that's the information I get from Mom. And then I meet with Buddy, and Buddy's screened, and it's discovered that this was the first time he'd tried alcohol. However, he's been smoking marijuana 2 to 3 times per week since school started. So he's been dabbling with marijuana, and he also reports that he's worried about his mom, that drinking again, especially when she gets angry or stressed. He also reports he has trouble sleeping, trouble focusing in school and at home. So there's several issues kind of coming up with Buddy. And so I'm going to make some recommendations. And one is going to be that he does get a full drug and alcohol assessment because he's smoking on a regular basis and he may need treatment. That he attends our Strengthening Families program with his mom. Mom's concerned about attitude. She's concerned about issues at home. That he does a life skills group at school. And then I'm going to suggest he goes to refer him to adolescent medicine at Seattle Children's for possible anxiety or ADHD. And that's just kind of a suggestion if he wants to go to a PCP or someone else. But a lot of people don't know about adolescent medicine, and so I really like to inform them and get them involved in that. So I'm going to talk a little bit about the life skills training program that we mentioned, and this is the Botvin Life Skills Training Program, and it's an evidence-based prevention program, and it teaches self-management, social and drug refusal skills through activities, education, and discussion. And I really like this program. I like it partially because it's pretty flexible in kind of how you can teach it and inform students. And I like because it's not just drug refusal skills. It talks about self-esteem. It talks about making choices. It talks about communication, those type of things. So this is done in 2 ways. One are classroom presentations, and at Eckstein we do this for the whole school. So it starts in 6th grade, and there are 15 lessons, and we do those in PE, and so teachers do them, and then I kind of support them in that. So I do kind of the drug and alcohol pieces, the specific drug pieces. And then in 7th grade, there's 10 booster sessions, and that's done in science. And then in 8th grade, there's 5 booster sessions, and that's done in social studies. And I support those teachers as well. But part of that, this was implemented by the coalition before I was even at Eckstein. And part of having the teachers do it is really that sustainability. So it just becomes part of the culture. We do life skills, and that's kind of what we do. The other way to present it is in small groups, and we do this as well. And that's just having kind of a small group, and you do the same curriculum, but it's on a smaller scale. You can practice skills. You can dig a little bit deeper. And so we do that. And so we put Buddy into a life skills group for high-risk 6th grade boys. And the group helps him, develop skills, including the social skills he'll need to do different activities. So it's not a therapeutic group. It's a skills group. And then we get to the Strengthening Families program. And this is a program I also really, really like. And I've taught other kind of parenting programs, but this is really a family program not just for parents, not just for youth. The entire family attends, and this is for parents and youth. Our version is for youth 10 to 14. And so we come, we have dinner, then the youth go to a session for an hour, while parents are in a session for an hour, and then they come together and do a family session. And it's really all about kind of giving the parents skills to set limits, but to show love and to do those type of things. And the kids, it's a lot about having fun, building trust, and learning. Then as the weeks go on, they kind of learn those actual drug refusal skills and how to make better choices. It's a really popular program. Part of the program is that you do dinner, that you provide dinner, and that it's suggested that you provide childcare. And so we do this twice a year at Eckstein. And so Buddy's family attends the program. Mom sees the postcard that the coalition sent to support it, and she's eager to attend, especially when she learns there's dinner and childcare, because those are usually, we can't get there at 5:30, we got to eat. Or I have a 7-year-old. Hey, don't worry, I got that taken care of. Buddy doesn't want to attend, but that's also how it usually goes. The kid they don't want to come back to school, after they've left for the day. That's not the idea of fun for them. But I just kind of say, just get them there, we'll take care of the rest. So they attend the program, sister participates. A lot of times if there's an older sibling, they're really good about participating. Younger brother has dinner with the family and then goes to childcare. Buddy's a little bit disruptive during the youth session, but typically youth are really focused during the family session. Mom and dad are there, and they're just really good during that session. The family attends all 7 sessions, and they work together to make a family tree, which you see there on your left. And then they work together to make a family crest, which is my all-time favorite family crest that anyone's ever made in strengthening families. And mom appreciates having other parents to talk to and learning how to set limits. So we do a lot of fun family activities. These are kind of our outcomes for strengthening families, and it's pretty successful. Really, sometimes the hardest part is just recruiting and getting parents there, which I ask a lot of help from the counselors and the principals, and then the coalition helps with their postcards and stuff. So this is a selective prevention for high-risk families. Again, it's 7 weeks. We're asking for a big commitment, but in our first year, we had 17 families attend. That started, and we had 15 families that graduated. And in order to be considered graduated, you have to attend 5 of the 7 sessions. And typically, most families attend at least 6. And then I have a few families that have perfect attendance. And in year 2, we had 15 families that started and 13 families that graduated. So we typically maybe lose 1 family during a session, but no more. And so I'm always kind of just get them in the door, we got pizza for you, we got some games, and then it's just successful. And most kids come around. Once in a while you have a youth that's going to be stubborn to the bitter end, but I'm like, they're showing up, so that's success to me. So here's our prevention clubs, and these are clubs that are just run by students, just a club. So it's open to all students. This is a universal prevention. This is not selective or targeted in any way. These are just kids. Usually it's because they know me from going in and doing the life skills lessons, and they're like, oh, Miss Kerby, or they'll come up and talk to me. And I'll let them know about the club, and some come. So the in-school one meets twice a week during lunch, and it kind of also gives them a safe space to go. And they just work on pro-social activities, presentations, do the bulletin boards, they do lunchroom stuff. We planted tulips. We do a lot of the week, Red Ribbon Week, Drug Awareness Week, those kind of things. And then we did an after-school group. And so I partnered with the after-school program, and 1 day a week we did a 2-hour kind of club so we could work on other things, kind of longer projects, and those are the top groups, the preventions. The bottom group is 3D, for Don't Do Drugs, and they designed those t-shirts, and then the coalition paid for them. And then Buddy comes to the group, and this is something that happens where, when students kind of know me a little bit, a kid like Buddy probably isn't going to come to my office for lunch and prevention club, but he kind of knows who I am, so he's going to come, and then he's going to maybe make some new friends that are a little positive. And I actually did have something like this happen with a kid. They said, I used to smoke, I used to drink, but I'm part of this club now and I don't want to do that anymore. And so it was a really good success. Again, the clubs in the coalition, this is us down on the right at the Washington State Prevention Summit, and the coalition funded our trip. So we wouldn't have been able to go without support from the coalition. They paid for our tulips that we planted during Red Ribbon Week. They provided our t-shirts. But then the Prevention Club gives a youth voice to the coalition. And they actually did go and present to the coalition and kind of gave their, they did a project for the year that they came up with, the Prevention Summit. And they presented that to the coalition. They asked for support. And they got some support on the video they made and different things. So, and it connects Eckstein kind of with the other high school clubs. And it connects me with the other clubs, so I can connect them. And then this is my favorite program. This is our Alateen group. So if any of you are familiar with 12 Steps, Alateen's part of the Al-Anon family groups. It's 12-step meeting for teens impacted by someone else's drug use. It's not for teens that are using drugs. So it's sometimes get confused, but is actually for kids impacted. And that's really the number one referral that I get, are teachers and people saying, you know, this kid, I think mom's drinking, or they have, you know, dad's not in the picture. And I get a lot of those kids. And those are really the high-risk kids. And I know that, and y'all know that. And so I really wanted to target them. And I had a Al-Anon sponsor that lived in the area contacted me and said, would we be able to do an in-school group? And I was like, heck yeah, we can. And they do them all over the country, and they're free, you know, something that can be done anywhere. But we didn't have any in King County. And so I was like, yes, please. And so they came up, I figured out, he got permission, and they got background checked as volunteers and everything. And the youth lead the meetings. We do it on a rotating schedule, so it's once a week, and then it's first period, the next week it's second period, then third period, so they don't miss the same class. And my role is just, I'm kind of the school liaison. So what I do is I, you know, have kids referred, and I kind of screen them to see if they can tolerate the group, if they're going to like it. I kind of give them a heads up about, you know, what it is and what it's about. I get their consent, their permission slip from their parents, and then we do it in my office. So that piece is there, that's my office, and I call the kids. But I don't run the meetings or do anything like that. I'm just kind of the liaison. Trying to get through. Sorry, so I'm going a little fast. And so in 7th grade, Buddy starts to attend Alateen. And I put that in there because a lot of times I have 6th graders that just really aren't in a space where they could attend an Alateen meeting. They really need a little bit of time to either mature or to do something like he does, which is a life skills group. And so we want to kind of have him prepared. And then this is usually typically kids don't talk the first couple meetings. And then they come in and they're like, can I chair the meeting? Like, can I do the stuff? And I'm like, yeah. And they get into it. So I haven't had any kids that have dropped out. They all, you know, they don't attend every single meeting, but they come back. And I put in here that I go to Buddy's IEP meetings. And that's because Alateen impacts his schedule. Now I would have a release of information with the school to be able to do this. I would also get Buddy's permission to do that as well. And I would let them know, you know, I call it to the staff and stuff, I say group. I just say we have group. Because I don't want to say we have Alateen. I don't want to break their confidentiality. And it's really, oh, there's my time's running out. So it's really just to help him and support him in that way. And so he can get credit for his behavioral plan. A lot of times teachers will invite me to IEP meetings and I'll say no thank you. Because I don't really need to be there for that. They're not, you know, it's not impacting me, and I want to keep that relationship safe. So wrapping up Buddy, he's seen by a provider in adolescent medicine, and it's determined that he is experiencing anxiety and depression. So he's referred to our adolescent psychiatrist for medication and our outpatient treatment program for drug and alcohol assessment and treatment. Buddy's grades improve, and he's able to decrease his time in homework center and actually participate in some fun after-school activities. And as he matriculates to high school, he's part of that school's prevention club. These are just kind of our program participation. You know, our selective prevention, my first year at the school, been there 2 years. We had 16 students screened. We doubled that pretty much more in the second year. No Alateen the first year, but the second year we had 10 students participate. And we have a few going to high school, but we'll be starting again in September. And then just overall non-duplicated students participating in programs. And there's a lot of students like Buddy that do Strengthening Families and Prevention Club, and they do a bunch. But we have 50 non-duplicated, and this past year we had 85. And then our Universal Prevention Life Skills, been able to get into every single classroom and do our presentation for the Life Skills program. And so I'm going to throw it back to Lisa to describe our treatment program at Seattle Children's.
Hello again. We just wanted to finish up with the tip of our pyramid in our conceptual framework with our adolescent substance abuse program. And I've given you some of this information already. It's a level 1 treatment program, state certified. We have a 0.8 licensed mental health counselor who's also a chemical dependency professional. She has clinic 4 half days a week in collaboration with our adolescent medicine specialists and a psychiatrist. The focus of our clinic really is on co-occurring disorders. And I will say most of the patients are referred by either hospital specialists who are treating kids with chronic illnesses, or adolescent medicine providers, or the inpatient psychiatric unit. In summary, our comprehensive framework touched Buddy's life in many different ways. His parents received a postcard that was initiated by the coalition, which gives information about how to increase parent monitoring, talks about the retail interventions. The coalition supports the prevention clubs that you heard about. In school, Buddy had been identified as a high-risk student, and he got referred to the prevention clubs, to Alateen, to the life skills group. He also received life skills curriculum. His family went to Strengthening Families program with a successful completion. He was diagnosed on a referral to adolescent medicine. He was diagnosed with anxiety and depression. He did go through a 90-day treatment program. If you recall, he'd been smoking marijuana 2 or 3 times a week, tried alcohol. We want to do very early intervention, and so the decision was made to have him go to counseling treatment using CBT and motivational interviewing for the 90 days. And he's successfully completed his treatment program and to date has no further use. And I think we can take questions now. Thank you.
And if you have questions, could you step up to the mic, please, since they're doing yes, we put you on the spot, because since they're doing the webcast, they need to use the mic.
I just wanted to ask, Kelly, when you do the Strengthening Families sessions, is there a curriculum to that about alcohol education, alcohol?
Yes,
all about that.
There is. I'm sorry I didn't explain that further. So we do it through Washington State University Extension, but it is an evidence-based prevention program out of Iowa State. And so there's a huge curriculum. There's 4 facilitators that do it, 2 for the parent, 2 for the youth, and then the family. And it's really, it builds up in week 4 and 5 to really doing like drug prevention and teaching them refusal skills and going through that. And then they kind of demonstrate that in week 6 to their parents. And so I have the parents pressure them and they have to refuse.
Right. It's not just fun and games and playing games together. There's some education.
Yeah, there's definitely education that happens, and it happens primarily in the parent and youth sessions, and then the family sessions, there's education, but we do like family meetings, like teach them, and then we actually do the family meeting. So that's kind of fun. So you get to practice. Yeah.
I'll also add that the program has a Spanish curriculum as well.
Yeah. Strengthening Families program. Yeah, go to Iowa State University and they'll have a lot of information on it.
I was just curious if you could talk a little bit about with all the HIPAA and FERPA laws, with you being in the schools, particularly with the screening assessments, how does that communication work between you and the schools? what results they get back, what they don't get back. With the outpatient, I think that's fairly clear, but with the screening and you being in the schools, I was curious how you work that out.
I work it, that's a great question. I work it pretty much the same as an outpatient program because I don't consider myself an employee of the schools. And so sometimes it's really hard to communicate that to the schools with the confidentiality. But I treat it the same. I always, we have a consent for our school-based health program. There's in Seattle Children's, they have programs in other schools, like sports medicine and those things. So we have a, the family or the student has to sign a release of information. So I make sure all that's clear. And, the suspension, they can take their long-term suspension. They don't have to get screened by me. And then in Washington State, we're kind of fortunate. The age of consent for mental health or chemical dependency treatment is 13. So at that point, in a lot of states, some states it's 18. In our state, it's 13. So a 13-year-old can come to me and say, I want this, and the parent doesn't have to know. I still have the 13-year-old sign the paperwork, and of course, that's part of the brief intervention. I try to get parents involved as well, and typically they do get involved, but that's kind of how we handle that.
I was just curious, do you need to let the school know the results of the screening tool, or just that a screening was completed?
They want to know, to end the long-term suspension, they want to know the results and what the recommendations are. And so, but that's all in the release, so that there's consent to release that information to the school, and then they make sure it's followed through on. Mm-hmm. Other questions?
When you do the gain queue, are you billing for that? And if so, can you talk about how you bill for it?
No, we're not billing for it. It's part of the grant. It was kind of a pilot program in our community in King County. So all of the people that have my job and with other agencies and other schools were trained to do the gain queue screening tool. And no, we're not billing for it. I don't know that there is a plan to bill for it. I think it's just kind of part of the prevention model, and then it's one of those, if I'm referring a kid to another agency, I can send that screening tool to supplement their full assessment. Yeah.
Is this one on? Yeah, I stepped out for a minute, but I don't know if anybody asked this question. Let's say someone doesn't seek the counseling to reduce the suspension. Then there's another, the student is caught again. Mm-hmm. Are there any consequences? Because that's what I found as a student is sent to me. The counselors do the SASE, and I've been working with the administration around, well, what are the consequences? Who's holding them accountable? That's a problem I've found.
Yeah, and that used to be the problem I found working in Seattle before I was in this position, and working as like an outpatient drug and alcohol counselor. When there weren't people in the schools, I found that really hard. The principals weren't following through. They weren't. Before they changed the policy Inga was talking about, kids would have to get suspended several times before they were required to get an assessment, and so that was what really part of the coalition influenced, was really changing that policy. I'm not sure on the exact policy. I know if they are caught, they could eventually be expelled from school. So I think there'd be another long-term suspension, and then they'd be moving towards possibly being expelled if they continued to get caught. But yeah, they don't have to. And usually there's a re-entry program. They want to kind of have a kid re-enter school, and they try to involve me in that if this child's willing and parent are willing. All right. Oh, great.
Hi, my name is Kayende. I work at the Native American Health Clinic in Oakland. I'm a health educator, and I'm wondering with Buddy, what happened afterwards when he moved from drugs and like marijuana and alcohol to ADHD meds and antidepressants. From a health education standpoint, I'm thinking, well, he was, self-medicating, and now he's medicating from a doctor. I'm wondering, is there some kind of care that goes to him managing himself after that? Like, what's going on with that? And also, say, for example, with my population, if he couldn't have the coverage to get into Seattle Children's or Kaiser where we are, then what's his option? And also, how do you deal with marijuana? Because for us, it's a big street economy. So if I say, oh, marijuana is bad, but you have to feed your mother, then how do you not demonize, it, but also help the child?
Yeah. No, those are great questions. Did you want to answer some, Lisa?
I think your first question was on basically his medical management. And so he'll continue to be followed by our psychiatrist for his medications. And, potentially at some point he'll be able to come off medications. And we'll continue to work with him to help him process through any, his mental health counseling needs. If he did not have coverage. So there are multiple agencies in Seattle, and each of them sort of is able to care for children with different types of insurance and different coverage. I don't have anything more specific, but we're so fragmented. I don't know that we want to go into that. We, in general, are country. I don't think we want to go down that road, though, today. And then I'll let Kelly maybe answer about the marijuana.
And I'll just say, bless your heart, you live in California, and you got to deal with marijuana, because we're getting it more and more in Seattle, so it's really, it's the hardest thing to do. Yeah, and I really try, especially when I go in the classrooms, to not demonize marijuana. I know I have students that have parents that are using it for medical reasons, and I don't, and it's kind of the same with alcohol. I talk about alcohol, and there's parents that drink, and they drink, maybe excessively or maybe responsibly. And so I just really try not to demonize those, and I make that clear because I want to get them engaged, and really trying sometimes to do the age piece, and really talk about the developmental brain, and you don't want to put drugs or alcohol into your system at that time. I mean, it's hard. Some kids do have to deal to help support their family, and how do you help them get away from that? I'm really fortunate that the school, Eckstein, is so supportive of helping students. I mean, they have, packs on Fridays of food for kids to take home that don't have enough food, and they're just really involved in trying to help students, and they're committed to the Strengthening Families program. They're committed to providing dinner. The school pays for the dinner. So I'm fortunate to be at a school where there are some resources and a little bit of money to help that. But yeah, I really try not to ever demonize it, and help them understand and get them involved in as many free programs as I can so they can continue to get some support. But yeah, I feel for you. It's the marijuana system, it's tough. It's a tough battle. Yeah. Yes. Yeah. All right. Is that going to be it? All right. Thank you. We'll let you out. I'm a little late. Thank you so much, and we'll be here if you have questions.